Hello and welcome to At Brookings. I'm Gigi Hinton. We begin today with President Obama's speech to the people of Islam. Foreign Policy Senior Fellow Shivli Telhami assesses the importance and impact of that speech. Then it's a conversation about healthcare reform and the nation's fiscal health with analysis from Senior Fellow Mark McClellan and Council of Economic Advisors Chair Christina Romer. Then the man on the street opines about the United States' relationship with the Muslim world. We'll have all that next at Brookings.
This is At Brookings, a review of news and events the week of June 1st, 2009.
From Cairo University in Egypt, President Obama delivered an address to the world's 1.5 billion Muslims. It was a speech intended to open constructive dialogue with the Muslim people. Foreign Policy Senior Fellow Shivli Telhami assesses the impact of the president's message.
I think he managed to begin changing the discourse, managed to get people to listen, managed to get people to respect him. But in the end, I think he's also raised expectations. He has successfully moved the conversation away from generalities and values into specific issues. And he enumerated a lot of important issues that are important to the Arab world, Muslim countries, as well as to the United States. And that's important. So in a way, he managed to shift from this broad confrontational issues of values and religion and culture and the history of the relations into the specific issues that he knows are important to everyone in Arab and Muslim countries.
The Islamic world, I think, has had such a negative impression of the United States for the past 8 years. And I think that seeing an American president come and speak to them in a way that shows an open hand and a desire to work with them on equal footing, on equal terms, I think that has a major impact.
They will have a dialogue and then they might be able to solve some misunderstandings.
Whether it will improve relations, I think, is up in the air.
I think these are extremely difficult issues. And one visit and one speech are not likely to change a very long and complex history.
And that's what I think.
The nation's healthcare needs continue to expand, and with that growth comes a major impact on the country's fiscal health. Engelberg Center for Healthcare Reform Director Mark McClellan moderated a panel of experts as they examined this critical topic. Council of Economic Advisors Chair Christina Romer presented findings from a new report on the economic impact of healthcare reform.
If we can genuinely restrain the growth rate of healthcare costs significantly while assuring quality, affordable healthcare for all Americans, living standards would rise, the budget deficit would be much smaller, unemployment could fall, and labor markets would likely function more efficiently.
If we can identify resources that are being wasted in healthcare and stop doing that, then those resources can be used productively to increase our economic well-being, to increase output. And some of those resources would be saved as well, leading to more capital investment, too. In the model in the paper, all of the federal share of reduced spending, I think, goes into deficit reduction and not into new government spending. And that plus the share of private spending reduction that is saved amounts to an increase in investment. Now, of course, this model works the other way, too. If we take some resources that we could use in other parts of the economy and add them into health care, then if they aren't used very well, if they aren't adding to value, if they're wasted, then economic output would go down and savings would fall and so on, the reverse direction in terms of economic well-being.
At Brookings is produced by the Brookings Institution. To learn more about the issues discussed on At Brookings, visit our website at brookings.edu.